understand all about your physical exercises. Now it's time for brain exercises. Как Сачин, вам холодно, что ли? Шляпу одел. Хороший мальчик. Today we will discuss with you tuberculosis. This is widespread infection, and patient in any age may acquire mycobacteria. Moreover, the immunity is unsterile. To have immunity, we need to have mycobacteria in our body. And the first meeting of body and mycobacterial usually result in primary tuberculosis. In more instances, the localization of primary tuberculosis complex is the lung. In less percents, the localization may be jejunum if infections pass into the body from the mother's milk in newborn. Well, but in more instances, we can see primary tuberculosis, lung primary tuberculosis complex. Subpleural localization primary effect, affected regional lymph nodes, and in between them, along lymph vessels, there are small foci of tuberculous productive inflammation. So, primary tuberculosis complex consists of three components: affect, lymphangitis, and lymphadenitis. Affect, this is focus subpleural, grayish-white color, firm, and pleura above it may be covered with fibrin threads. Along lymphangitis, there are small grayish nodules, and lymphadenitis, this is really tuberculosis of lymph nodes, whitish yellow soft masses. Let's feel your legends about this growth. Primary tuberculosis complex, primary effect localization, subpleural, size about 1 centimeter, color yellowish gray, consistence soft, pleura is covered with fibrin threads, lymph nodules in the lung hilus are enlarged, soft, with yellowish white masses. Enlarged, soft, with yellowish white masses. Lymphangitis with small grayish foci along lymph vessels. So, histologically, another variant. Histologically, we will see next changes. All pictures. Primary tuberculosis effect. The slide number 137. We can see focus of caseous necrosis, localization subpleural, and it's surrounded by inflammatory cells. They include macrophages, epithelioid cells, single multinucleated giant cells, and lymphocytes. Engorged blood vessels can be seen. More high magnification, necrosis, epithelioid cells, macrophages, lymphocytes, Langhans type giant cells, and engorged blood vessels. Now your legends. Point number 1 means caseous necrosis. Point number 2 means perifocal infiltration consisting of letter A, single neutrophils, B, macrophages, C, lymphocytes, and single Langerhans giant cells. Single Langerhans giant cells. Within regional lymph nodes, we can see formed tuberculous granuloma. Slide number 49. Langerhans, yes. Within lymphoid tissue, we can see caseating epithelioid granulomas. This is marker of tuberculosis. In the center, there is focus of caseous necrosis, and it's surrounded by epithelioid cells, single multinucleated giant cells, monocytes, macrophages, and lymphocytes. Blood vessels in between these cells are absent. So your legends. Point number 1 means granuloma consisting of granuloma consisting of letter A means caseous necrosis, B epithelioid cells, D or A, B, C macrophages and giant cells, macrophages and giant cells, D lymphocytes. Point number 2 means remnants of lymphoid tissue. Point number 2, remnants of lymphoid tissue. 2 часа, пожалуйста, 10 человек, 2, 3, 10 человек первый.
Asha, where's your book? Where's your book?